Kenya's capital, Nairobi, is projected to soon be a region of great benefit to citizens seeking healthcare in the city. President Uhuru Kenyatta's most recent address confirms that the official opening of 7 hospitals in Nairobi will take place by the end of January this year. Further, in 3 months' time, 10 more hospitals will be officially opened in Nairobi. The president indicated that the move will go a long way into eliminating overcrowding in some hospitals in the city as well as in other regions across the country.
Nairobi no Kenyatta.
We want all regions to have hospitals in Nairobi. We are also looking to increase fundings in other regions across the country to achieve the same purpose. For a nation without good health will always remain poor.
While recognizing the steps being taken by the health sector in the right direction, President Kenyatta reiterated that their main goal is to ensure that all citizens have access to a health insurance in order to facilitate the payment of medical bills.
We want a health system in Kenya that will ensure no one lacks a chance to be treated owing to the fact that they cannot afford health services.
In addition, President Kenyatta has noted that health services in hospitals under the management of the national government, such as Kenyatta Hospital and Moi Teaching and Referral Hospitals, are continuing as normal, urging health workers who have boycotted medical services to return to work despite the challenges they face.
What they are now fighting for is not payment of salaries, but an increment of the same. This is not an issue. However, an increment cannot be made beyond what the county government can afford.
This comes even as COTU Secretary General Francis Atwoli lashed out at the Council of Governors, led by its chair Kakamega Governor Wycliffe Oparanya, over their move to disown an agreement between striking medics and the Ministry of Health, terming the approach as blind.
If a pandemic breaks out in any of these schools today, and the medical or health staff who provide services, including doctors, clinical officers, and nurses, are on strike, what will happen to this country?
It is very interesting, Governor Oparanya, that you are lining up 60 nurses today in Buhungu Stadium to give them 60 letters to go and replace 1,206 striking nurses. Look at you. Are you listening to yourself?
Atwoli has now called on the government to take charge and end the strike.
This is an essential area which concerns the lives, the multitude lives of Kenyans, and nobody, including politicians, who are supposed to take it from a face value.
The return to work agreement is not about paying. It is about looking at ways of getting to find further solution to issues raised by health workers.
Ben Kirera, K24, Evening Edition.